Although Australia is a leader in research and understanding of post-operative pain, application of assessment tools and pain management strategies are still severely lacking. Short-term impacts of acute post-operative pain include tachycardia, hypertension, reduced glycemic control, reduced mobility, reduced healing times, lengthy hospital stays, anxiety, psychological distress, and physiological changes. Long-term impacts include increased risk of readmission, development of chronic pain, depression, anxiety, loss of independence, inability to carry out activities of daily living, reduced quality of life, dependence on pharmacological analgesia, and loss of income. 75 to 80% of all post-operative patients will report pain that is either moderate or severe, with evidence indicating that up to 50% of patients stated they did not receive adequate pain management. Post-operative pain is therefore often unnecessary suffering experienced by the patient that can increase their risk of short and long-term complications. Although pain management is usually carried out collaboratively with members of the multidisciplinary team, nursing staff play a key role in the assessment and management of acute pain, as they are often the ones carrying out pain assessment tools, as well as administering prescribed medication and making judgment calls about the provision of breakthrough analgesia. Stigma and concern against the overuse of opioids, as well as poor implementation of pain assessment tools, are some of the influencing factors that impede appropriate pain management of the post-operative patient. The use of overly simplified pain scales, such as the 1 to 10 scale, rather than a more comprehensive tool, can impact the efficacy and applicability of pain assessments. Although the numerical pain scale is very effective in quickly identifying severity of pain and assessing the effectiveness of analgesia, it has limitations as it fails to take into account the prohibitory impacts of pain that may impede the individual's functional ability. If a patient states that they have a 5 out of 10 pain at rest, this may be seen as moderate and therefore manageable, but when using an alternative pain scale, such as the clinically aligned pain assessment tool, it is identified that the patient is unable to sleep, rest, or mobilize as a result of the severity or location of the pain. The use of a more thorough and holistic tool in the early stages of the post-operative pain management could assist in provision of pain relieving strategies, which may lead to increased mobility, wound healing, and decreased hospital stay, as well as reducing the incidence of chronic pain development. Presence of preoperative pain, fear, and anxiety are aspects of an individual patient's experience that increase their risk of acute post-surgical pain. Strategies to reduce the effect of these factors include staff and patient education, as well as appropriate support to address the individual patient's concerns. Barriers that may affect these include staff attitude, lack of appropriate knowledge, insufficient time, and possible cultural and language barriers. Post-operative factors that may increase pain are poorly managed pain at any of the stages during admission, including the post-anesthetic care unit, on the ward and before discharge. Appropriate assessment of pain using recognised pain assessment tools, staff education, and prioritising pain can assist in providing appropriate analgesia or pain-reducing strategies. Barriers to these include staff attitude, acuity of other patients, time management, language or cultural barriers, or possibly the individual facility's lack of resources to assess and manage pain. Active involvement of the patient from the preoperative period throughout the admission and recovery period, utilising a patient and family-centred approach, is key in providing appropriate and targeted pain assessment and management for the individual, and reducing the burden of post-operative pain. Ensure time is taken to educate the patient on the procedure and involve them in the planning of pain management strategies, as well as identifying risks for increased post-operative pain. Increased training and education for the health professional will assist in the assessment and management of post-operative pain, as it will enable the health professionals to better understand and identify the impact of pain on the individual, their risk of developing comorbidities as a result of acute pain, and the specific pain that may result from particular surgeries or procedures. Thorough education and training, as well as the collaboration of the multidisciplinary team, including access to an acute pain service, will assist health professionals in providing appropriate, effective, and timely pain management. Multimodal or non-opioid analgesics, as well as the use of alternative pain relieving strategies, are recommended to reduce the burden of postoperative pain. Although opioids have long been the primary modality of post-surgical pain relief, a multimodal approach is more effective in targeting different aspects of the experience of pain. Local anesthetics, spinal blocks, and epidurals are used to block the pain signals from reaching the central nervous system, with evidence suggesting that pain management within the first 30 minutes in the post-anesthetic care unit being a key factor in the ongoing management of surgical pain. Psychological support, promoting physical comfort, cold compress, diversional therapy, and encouraging mobility where appropriate are non-pharmacological strategies that assist patients in the management of postoperative pain. It is important to provide ongoing assessment and management of pain throughout each stage of the admission and discharge, including postoperative follow-ups to ensure that the pain management provided continues to be appropriate and effective, and so that oral analgesia can be reduced appropriately to prevent long-term dependence. The aim of pain assessment should focus on achieving functional goals, such as independently carrying out activities of living, rather than solely using numerical scales to assess the pain, and shifting the psychological focus from pain as a number to the reduction of pain and an increase in autonomy, independence, and quality of life. Much research has been carried out to identify strategies to assist in the management of postoperative pain, including increasing staff and patient education, ensuring pain is considered a health priority, adopting multimodal pharmacological strategies, psychological interventions, and specific postoperative pain assessments.